if we go back to the work with Bill and the trials you folks are on, you folks, the most recent one being a phase 2. Have you recently done the phase 2 trial? Is that the most recent one that you folks?
Yeah, so the most recent one we completed was a phase 1/2A study on our allogeneic preparation, our proprietary cell line called MAG200. So that was a phase 1 safety. It was what we call an ascending dose study. We started at a low dose. We then, as we show safety, we go to the next dose. And we're really wanting to see whether we can see a dose response curve as well. You know, what is the most efficacious dose? So in that same safety study, we then followed those patients out to 12 months for efficacy markers in both pain and function and structure. From that, which was a very successful trial, the therapy was well tolerated, very safe. We were able to see both a low and high dose, which was very efficacious in both pain and function. There was a trend that the high dose was more efficacious in regards to disease modification and prevention of progression of osteoarthritis or improvement in cartilage volume. So we're now on the footsteps of actually commencing our phase 3, our pivotal phase 3 trial. Yeah. Which will be to show reproducible evidence that MAG200 is suitable for the treatment of osteoarthritis. And that trial will support registration, hopefully in both Australia and international regions.
International regions as well. Okay. So potentially people are looking, can they come from other countries into Australia, or is there a difficulty because you may have to do the follow-ups and they may have to come like back and forth?
Yeah, unfortunately for the study, it's Australian based only.
Yeah.
Because of the level of follow-ups and face-to-face visits over the time course of 12 months post-treatment, it really is only for Australian residents. Now, that said, we would be looking to have fairly efficient recruitment. We hope to be actually putting in registration for both registration in Australian and international regions in late 2028. This is an area of unmet clinical need. So most regulators have an expedited fast-track approval pathway for unmet clinical needs or areas of unmet clinical need, of which osteoarthritis is one. There's a real understanding internationally that we need to find a different, therapy as opposed to simple pain relief and joint replacement surgery.